Good evening, my dear students. Here you can see MCQ from the topic rules of administration. So let us discuss one by one. The first one, which of the following route of drug administration is most likely to lead the first pass effect? What is first pass effect? So the first pass effect is a process in which a drug undergoes metabolism at specific location after administration. So among all these routes, which route has the most first pass effect? Sublingual, oral, intravenous, intramuscular. The answer is option B, oral. Then, which of the following factor may affect the drug absorption rate from injection site? Which of the factor may affect the drug absorption rate from IM injection site? Muscle tone, amount of body fat at injection site, blood flow to the injection site. The answer is D, blood flow to the injection site. Is there any change in this? Is there any change in this blood flow to the injection site? Then it affects the drug absorption rate after administration. Then next question. Which of the following site must be avoided while giving IM injection to 2-year-old child? Which of the following injection site must be avoided while giving IM injection to a 2-year-old child? Deltoid muscle, dorsogluteal muscle, ventrogluteal muscle, vastus lateralis muscle. The answer is B. So, for 2-year-old child, we must avoid the dorsogluteal muscle when we are giving IM injection, because this dorsogluteal muscle is not sufficiently developed and it is not safe injection site for the infants and small children too. And apart from this, remaining sites are safe for giving IM injection for a 2-year-old child. Okay, then next question. Route of administration of BCG vaccine is ID, intradermal, subcutaneous, intramuscular, oral. The answer is intradermal. Okay. Not only that, not only for this BCG vaccine, this intradermal route we can also use for the drug sensitivity test also. Okay, the next one, the needle is inserted. The angle of needle insertion for ID is 15 degree. Next step. All are local routes of drug administration except topical, intraarticular, oral, intravaginal. Answer is oral. Topical, intraarticular, intravaginal are the local route of drug administration. So oral route not a local route for drug administration. Okay, the next one. Which of the following is the most preferred route of administration in an unconscious patient? Which of the following is the most preferred route of administration in an unconscious patient? Inhalation route, enteral route, oral route, parenteral route. The answer is parenteral route. Okay. The next one. Injection of a drug directly into the joint is called. Injection of a drug directly into the joint called intraarticular, intraarterial, intraossicular, intramedullary. The answer is intraarticular. Then next question. Administration of drug into spinal cavity is termed as intraarticular, intraosseous, intramedullary, intrathecal. And the answer is intrathecal. Administration of drug to the joint is called intraarticular. Administration of drug into spinal cavity is called intrathecal. Next question. Which of the following route of administration refers to introduction of drug directly into bone marrow? Intraarticular, intramedullary, intraperitoneal, intrathecal. The answer is B. Intramedullary. Then. Next, application of drug on the skin with friction is known as inhalation, infiltration, infusion, injection. The answer is injection. Then, administration of drug in liquid form into body cavity or body orifice is known as inhalation, insertion, infiltration, instillation. The answer is instillation. Then, test dose of penicillin is administered through dash route. Test dose of penicillin is administered through dash route. Intradermal, intramuscular, intravenous, subcutaneous. Intradermal. Which of the following drug is administered sublingually for the management of angina pectoris? Aspirin, nitroglycerin, atenolol, warfarin. Here the answer is B. Nitroglycerin. Then, so here, what is the purpose of using this nitroglycerin is nothing. Nitroglycerin for this angina pectoris. So this sublingual nitroglycerin rapidly absorbed in the circulation through blood vessels in sublingual mucosa under the tongue. So is useful. So that's why the drug preferred for management of angina pectoris. Then next one, the route of administration of nitroglycerin is already we discussed. Answer sublingual. Okay. Then appropriate site for administering iron injection is anterior thigh, dorsogluteal, ventrogluteal, all the above. And the answer is dorsogluteal. Okay, the next one. What is the best reason for the nurse in instructing the patient to rotate injection sites for insulin? Lipodystrophy can result and is extremely painful. Poor rotation technique can cause superficial hemorrhaging. Lipodystrophic areas can result causing erratic insulin absorption. Injection sites can never be reused. So what is the best reason for the nurse instructing the patient to rotate injection sites for insulin? Already we know we should not give insulin injection in the same site because it causes lipodystrophic areas damage and it results erratic insulin absorption. Here you can see administration of insulin in the same site or site, it causes lipodystrophic areas development, and because of this it affects the absorption of insulin. So that's why we should not use same sites for insulin injection. Okay, the next question. Sensitivity or allergic reaction to the drug is tested by administering the drug intradermally, subcutaneously, intramuscularly, intravenously, and the answer is intradermally. For checking sensitivity or allergy reaction, so we must use the route intradermal route. Thank you all.